Now, I would be remiss if I ended my comments without talking to you guys about healthcare. So let me ask you guys a few questions. First of all, I want to invite you to go to my website, turner.house.gov. We've done an excellent job, as my team has, of putting together a website that's fairly interactive. We're trying to ensure that we not only have information there for people, but also places that I've spoken, things that I have, where I've answered questions. We have those up on the website so that people who haven't made it to any of them can hopefully get some of their answers, their questions answered, because they're similar. So I want to ask you some of the questions that I've been asking people throughout the district. It is clear that we're going to have some form of healthcare reform. There are portions of our system that are absolutely broken. And I believe, though, that the bill that's in place is not that fix. But I think there's a number of things that we probably all agree on. And I want to ask you those questions to see if we agree. And let me ask you, how many of you know someone who does not have health insurance? Or know someone who hasn't had it, or perhaps even yourself, had a period of time where you haven't had health insurance because you were between jobs or circumstances like that? How many of you know someone who's gone without health insurance? And that's not right. I mean, we need to have a system where we can provide health insurance coverage where people are changing jobs, they have some event where they can have coverage and they can get the type of medical care that they need. How many of you are concerned that either because of a pre-existing condition, or you know somebody who's concerned because of a pre-existing condition, that they're afraid that if they lose their job and they have to go to another job, that they won't have medical coverage? Could be diabetes, heart condition, or cancer, where they're worried that the next employer will exclude their coverage because of a pre-existing condition. I think it's an important issue. I don't think insurance companies should be able to exclude pre-existing conditions. You should come to an employment and to an employer-based health plan as you are, and you should receive coverage. How many of you are concerned that Medicare is headed toward insolvency? We know that the projections are such that it doesn't have, that there's not enough money in it, and we're concerned whether or not that's going to affect the level of care for our seniors. Many are concerned with Medicare's insolvency. That's very important. We need to fix that. This plan takes $500 billion out of Medicare, $150 billion out of Medicare Advantage. You cannot take a plan, you cannot take a program that is going insolvent and take money out of it and make it more solvent. Everyone knows that. And that's a major objection that I have with this plan. How many, I like asking this question, how many of you like your doctor? I like my doctor. And you know what I like about asking this question? Is when everybody raises their hand about 5 or 10% down, and I think, gosh, you know, what, who's your doctor? How many of you think that the government should not be involved in a doctor-patient relationship? That what their doctor says and care and coverage ought to be the issue in the medical treatment you receive? Very, very good. How many of you are concerned of the end-of-life counseling provision in this new plan? That the government is going to sit at the table and give you assistance and counseling on how you should handle your affairs as you head toward end of life? Because it concerns me, because I don't think the government should be at the table. And how many of you are concerned about the out-of-control spending and what it's doing with the federal spending? I don't think you get very many happy dollars for the deficit, but I think absolutely people are very concerned, especially coming on the heels of the bank bailouts, which I voted against, the stimulus, which I voted against, the acquisition of General Motors, and their bailout, which I voted against, and then cap and trade, where the government is going to step in and make it much more difficult for energy production. Of course, makes it more difficult for job production. That these types of issues, when we go to establishing a national health care plan, will increase spending and make it more difficult for us to produce jobs. Well, I want to tell you real quickly, there are some things that I'm for that correlate to the things that we just talked about that I think most of us agree on. One, I think that insurers should be prohibited from excluding pre-existing conditions. Two, I believe that medical research is really important, and it comes and results in the innovation that increases our care. This plan actually provides a commission to determine medical research and the areas that are to be supported. I think that health insurance should be portable from job to job. Right now, under our current laws, your employer, your current employer, can't let you disconnect your health insurance from that employer, and your new employer can't allow you to take that with you. Even if you're self-employed and you have a self-policy, an individual policy, you don't have the ability to take that then to an employer and say, I want to join as one of your employees, but I want you to pay for my existing health care. They don't have an ability to do that. I think that small businesses should be able to join together in national associations to provide health care. I voted numerous times on the House side to allow national associations to do this. Today, if you're a small business and you have 15 employees, you're certified as a group of 15. If you're a member of the National Association, your National Association does not have an ability by law to pull all of the National Association members together and provide one giant policy that everybody joins into. And with the realtors, that's a big issue. A lot of our realtors are uninsured, and the National Board of Realtors has no ability to go and get a policy covering all of them. That's something that I have supported many times in his guidance. And if they were really interested in expanding healthcare coverage, they could give increased tools for people to provide health insurance. I believe that they should have deductibility of health insurance premiums. Employers can deduct them. You ought to be, if we're going to encourage health insurance, if we encourage home ownership and allow the interest deduction, we should encourage and permit the deductibility of health insurance premiums. And also, we have to reform our tort system and get rid of the frivolous lawsuits that drive up the costs for our doctors